Welcome back, everyone. I'm sitting down with Nathan Richards from LDS Hospital, who is a general surgeon, and we're talking about hernias. This is something I didn't realize 25% of men will develop a hernia in their lifetime.
Yeah,
it's a lot.
Yeah, it is. It's very, very common.
So tell everyone what a hernia is for those who aren't quite certain.
Absolutely. So most of the time when people think of hernias, they think, oh no, I've got a bulge, or I've got this pain and it kind of comes and goes and whatnot. Right. A hernia basically is as a hole. If you think of a hernia as a weak area or a hole in the abdominal wall muscles that basically allow something, almost always it's fatty tissue, to kind of bulge through that hole. Which can cause pain and discomfort.
Okay, so what causes the hernia?
Lots of different factors. There's congenital hernias, which most of the groin hernias that we see out there are, and that can happen in both men and women, and that's what's most common in men. Certainly, prior surgery can cause hernias. I see a lot of what we call incisional hernias in the belly wall. And then just, there's a lot of umbilical hernias, which is hernias of the belly button from the umbilical cord.
Okay, so how do you know if you have a hernia?
Great question. So usually, you go to your doctor and the doctor says, that looks like a hernia. But most of the time, it's going to be pain, it's going to be pressure, it's going to be discomfort. Most people that have outies, that's actually a hernia.
Oh, you're kidding?
Yeah.
Oh, that's so interesting.
Yeah, most of the time it just results from the failure of the belly wall to really close tightly enough around the muscles where the umbilical cord went through, and so it results in an outie. Most kids will have an outie and then that will get better at about age 4 to 5, but a lot of us keep it.
Okay, so is a hernia dangerous? It
can be, but rarely. So it used to be, prior to about 2006, that we would fix everybody that had a hernia, just that walked in. There was a great study done actually in the VA hospital system that said, that the actual risk of a hernia where you get intestine that kind of gets stuck in there, and anybody that visits Dr. Google will see those pictures.
Dr. Google, yes.
He found that the risk of that happening is really about 0.3%. So it's really uncommon to actually have it be dangerous. Most of the time, they do become symptomatic, meaning they hurt, and they become uncomfortable, and that's when we fix them.
Okay, so how do you fix a hernia?
Great question. There's about 3 different ways that we can do this. There's an open technique, which has been happening for 100 years, where we make an incision through the skin, go right down into the hernia, sew it closed, maybe use an implant like a mesh or a graft. Then back in the late 90s, early 90s, we started doing laparoscopy, where we make small incisions kind of away from the hernia and did the hernia from the inside using a TV screen. And more recently, we've actually used some computer-assisted or kind of robot technology to be able to get in and sew the things closed and combine those 2 procedures.
Which is a newer technology that you're offering now that has been very effective, right?
It has, yeah. It's still certainly new on the kind of the treatment of hernias, but yeah, it's a newer option that allows us to really decrease the pain, increase speed up the recovery time, but really get as good of a repair as we would with open and laparoscopic, if not better.
Okay, what is the treatment like after you're done? After the surgery, is it you're down and out for a while, or?
Great question, and a lot of it depends. In the old open technique, yeah, you would be down and out for a while, especially in an incisional hernia along the middle of the belly, which is a big, huge incision sometimes.
Yeah.
What we can do specifically with the robot is that we can do that huge repair in and out of the hospital. Most of my patients go home that day. Most of them will have some pain, certainly, but not enough to really lay them out. And so most of the time, say I operate on a Thursday, you're kind of back at work on a Monday.
Wow.
It's pretty amazing.
This is a common issue for a lot of men and women, too, I'm sure.
Yeah, a lot of women, especially with pregnancy, stretching out the abdominal wall muscles.
Right.
You get incisional hernias and belly button hernias very, very commonly.
Yeah, good stuff. All right, you guys, if you want more information on anything related to hernias, go to the website, ldshospital.org. And Dr. Richards, thank you for being here. This was great information, and we'll have a link to all of their stuff from our website. Thank you. Appreciate it.